This question is, are children with seasonal allergies more likely to develop ear infections? I'll start out by explaining my mentorship. I mentored Dr. Georgie Reynolds at UT Physicians. I observed a lot of well child visits, sick visits, vaccinations, ADHD evaluations, stuff like that. I have some stories, something interesting that I saw actually the last time I went. Okay, so I'll start with a little bit of follow-up. So whenever you're at the, whenever I'm shadowing him, he has on his computer a list of all the appointments, and in each, in the little corner, has a brief description of what's happening. So right arm pain, runny nose, fever. This one said crayon in the ear. So we went in to go observe this little boy. He was about 6 years old, and he was just as cute as can be, I guess. He was kind of really grumpy though. You could kind of see that he had kind of a old soul mentality to him. So he explained to me that in his classroom, the teacher was playing this video, and the video just wouldn't stop, and it was just annoying him so much. And he was like, how can I get out of this? So he saw this little blue crayon next to him, and he broke off a little part and decided to stick it in his ear to get rid of the video sound. And then after that, he was like, crap, I can't get it out. So then he decided to shove 2 pencils in his ear and try to, kind of spear it out. So he was trying to do that. His efforts were unsuccessful though. And sure enough, whenever you went to go look in the ear, you could see this little blue crown, and it was fabulous. I also a few weeks before that, I saw a green pea in the ear, or a green beet or something. Yeah, lots of things in ears I've seen. Pretty great. Dr. Reynolds says actually the most interesting thing he's seen in an ear is a tooth, which I just don't know about. I don't know. Cool stuff. So basically, he's an overachiever. He went to Yale. He was valedictorian of his class, MVP of the soccer team at his school. Yeah, he took so many classes that he didn't have a lunch period. So instead of going to lunch, he would just run by, between the 5 minutes of classes and just grab all the desserts, because that was the only thing left over, and that's what he would have for lunch for his 4 years of high school. It's pretty cool. So whenever I shadowed Dr. Reynolds, I saw a lot of ear issues. I saw a lot of things in ears, lots of things in ears. So I decided to observe what could cause ear infections to occur more regularly. I also, in correlation to seeing lots of ear appointments, ear-related appointments, I saw a lot of allergy appointments. So kids who are coming in with lots of congestion, chest tightness, things like that. So my hypothesis is, if children have seasonal allergies, then they will be more likely to develop ear infections. So what's an ear infection? An ear infection doesn't usually occur just by itself. It usually spurs off something else. So say Timmy has a runny nose, he has a cold. This causes excess swelling to occur in the nasal passages, which doesn't allow for proper irrigation of fluid, because the sinuses are swollen, so the fluid has to go somewhere, so it goes to the inner ear. And the problem with children is that they have a very shallow ear canal. So it's kind of like you're going down a slide. You go down the kiddie slide, you go really slow, but it goes down the adult slide and it just goes a lot faster. So the problem is when kids have this swelling, it's really hard for them to have the fluid evacuated from the ear. So this causes infections to occur. It can either be bacterial or viral, but it's just from that excess fluid in the ear. So this is a continuation. So the ear has 3 parts. You have the outer ear, the middle ear, and the inner ear. And the eustachian tube connects from the middle ear to the back of the nose. And this, you can see the connection. So it connects from the back of the nose to the ear. And whenever your sinuses are swollen, if you have fluid going, then obviously it's not going to be great as well, because they're all connected together. Here's a visual, and you can see the ear canal, and you can see how it would look in a normal ear opposed to an infected ear. You see it's red, it's swollen, sometimes there's even pus in there, and it can get really, really swollen. It can be really uncomfortable for the child. So here's another one. This is what you would see if you're looking through the scope. You'll see it. I've seen quite a few ears. He lets me look at a lot of the infected ears, and they usually look really, really red. And you can see that the tube is more swollen than it would be on a normal ear. And I have a video you guys can look at. Just kidding. Sorry. Is it volume?
Wow, my doctor told me about it.
Ear infections can involve any of the three anatomical parts of the ear: the outer ear, the middle ear, or the inner ear. Inner ear infections are almost always viral. It is very unusual to have a bacterial infection in your inner ear. Viral inner ear infections can affect either the organ of hearing or the organ of balance. When the organ of hearing is affected, the infection will usually present as a sudden hearing loss. It will not present with pain. In addition to hearing loss, it may cause a ringing noise in the ear, which we call tinnitus, or a sense of fullness or distortion. Viral infections of the organ of balance present as imbalance or vertigo. Vertigo is the false sensation of motion, such as the room spinning or the floor rocking. Occasionally, viral infections of the inner ear will affect both the organ of hearing and the organ of balance, and an individual might present with hearing loss, tinnitus or ringing in their ear, and dizziness, all at the same time. The treatment for viral infections of the inner ear is usually oral steroids, such as prednisone, if there are no contraindications. In other words, if you don't have a disease which might be made worse by the prednisone. Inner ear infections are generally viral, and they can affect either the organ of hearing or the organ of balance, or both. If they affect the organ of hearing, they will cause hearing loss, and if they affect the organ of balance, they will cause dizziness.
Okay, so that video was just meant to kind of further explain the symptoms involved with different kinds of ear infections. So now I go into what are seasonal allergies. They're often called hay fever. They're essentially allergies that occur during certain times of the year, and they usually occur when outdoor molds release their spores, and trees, grasses, and weeds release tiny pollen particles into the air and fertilize other plants. So there's lots of different allergens, and they all occur at different times of the year, so just have to figure out what time period. So symptoms of seasonal allergies: sneezing, itchy nose and throat, nasal congestion, clear runny nose, and coughing. And the symptoms of seasonal allergies really mimic the symptoms that cause an ear infection to occur. A lot of it's just that nasal swelling that will cause the fluid to get backed up. So when you have this congestion and stuff, the walls of the sinuses are really inflamed, and that makes it a lot harder to irrigate the fluid from the ear. So there's this study done, and basically it's just explaining the simple correlation between ear infection and allergies. Basically, we've already identified what causes an ear infection, and a lot of what causes an ear infection is just after you get sick and the excess fluid and stuff, which I've said many times. And they just realized that ear infection will be 4 times more likely in children with allergies, and the children who are more likely to get the ear infections are 2.5 more times likely to have asthma or other nasal issues than the control group of kids who just don't have allergies. And yeah, so this article by the New York Times indicate that 40 to 50% of children over 3 years old have chronic ear infections, also have allergy rhinitis or hay fever, which is basically just seasonal allergies. Yeah. Although this article says that a causal relationship between allergies and ear infections have not definitely been established, but it's more just a fact of like common sense, of like something that has the same symptoms is causing ear infections to occur. And it's just common sense. There's another clinical study done with 448 patients with middle ear infection. 57% had asthma, an allergy-based asthma problem, and 95% had allergic rhinitis, and 60% had skin rash. And all of these, they noticed that the patients with the allergy rhinitis were a lot more likely to develop ear infection. So this is just another reiteration of what I was mentioning before. The normal pattern of like ear infection occurring is usually because of the nose and sinus blockage caused by any kind of, like any other, a number of factors, which can be allergies, just a simple cold, anything like that. So here's some ethical and moral issues. One issue is that insurance companies seem to be don't really like, are not providing the proper coverage for allergy medication, which causes, obviously, the allergies to be not managed correctly, which will cause more ear infections to occur in the future. Another thing that people with allergies have to identify for the treatment to be truly effective is they have to get their allergies tested, and they have to figure out what affects them, when it affects them, and where it affects them. I actually just read something online in the news, and it was saying how like we all like think about like the times of year where allergies come out, like in the trees or whatever, but also we also have allergies in our food, because our food is like vegetables and produce and stuff. It's all manufactured outside. It's not like we don't like stuff that's not made in a factory. It's all outside. So whatever pollen or mold or whatever is spraying in the air is going to be in your food. So you have to be careful with like what you eat during certain times of year, because that can aggravate your allergies as well. And if you don't get the proper allergy medication, you're obviously going to have a quality of life issue, because you're going to be struggling with something that can be easily mended, and you have to be able to treat it properly, or it's just going to be really miserable. So my conclusion is that children with allergies are more likely to develop ear infections because of the excess fluid that is brought upon by allergies.